My name is Sam Chapman. I live in Oregon, in Portland currently. I got involved with medical marijuana specifically and cannabis in general in high school. And then from there in college, I just graduated from the University of Oregon last year, where I got really involved with the movement through Students for Sensible Drug Policy. And a lot of you are probably asking yourself, what is that? That sounds like a DARE program or something. Actually, it's the opposite of DARE. Students for Sensible Drug Policy is a national organization with over 200 chapters across the country at colleges, and they work on issues from harm reduction and drug use in general to legalizing marijuana to teaching students how to deal with police encounters. So that's kind of how I got my start in policy in general. Throughout college, I was involved with the Measure 74 campaign in Oregon, which sought to bring medical marijuana dispensaries. Failed, got 44%. I worked on the Measure 80 campaign to legalize marijuana. Failed, got 47%. And just recently, through the legislature, we've had a lot of success. In fact, the most success we've ever had, I would argue, in Oregon through the legislature. We just legalized medical marijuana dispensaries in Oregon. We just passed a bill that added PTSD to the qualifying conditions for our medical marijuana program. And we also just passed a couple of bills reducing the marijuana sentencing guidelines in Oregon. A lot of people have known that marijuana has been decriminalized in Oregon, well, for a long time. It was the first state to decriminalize, right? However, anything over 28 grams is a felony, was a felony in Oregon. Now we've bumped that up to a quarter pound. I know a lot of people, not enough. Well, we're getting there. But now it is no longer a felony to have up to a quarter pound. It's a misdemeanor. So, yeah. That's basically what we've been doing in Oregon. You're probably asking yourself, what the hell is up with legalization in Oregon? Good question. So there's a couple things circling around right now. We don't have a formulated game plan. However, if you were to ask me whether I think it's going to be 2014 or 2016, I'm leaning towards 2014. It's because we're going to have same-sex marriage on the ballot, our governor's up, a bunch of politicians are up, and we could very well see the highest youth voter turnout in an off-presidential election in Oregon history. So it's going to be a fun election to watch, for sure.
Right on, right on. Thank you all so much. As you guys can hear, we've got an amazing series of experienced activists here, and obviously everyone's working in different jurisdictions, different areas, different lawmakers, but what I want to hear is kind of what we all share in common, which is what's been working in terms of your campaign. Is it a safer model where you got to compare cannabis to other models? Is it just a matter of educating the voters? Is it bringing soccer moms on side? So I want to hear what's been effective in your outreach, in your campaign, to make change in your communities so that we can all learn from each other and move ahead.
Well, one of the groups that I work with now is the Cannabis Action Coalition, and we started a website called 420 Leaks. And what we've done is we've basically taken all the public records requests that we've been getting on the Liquor Control Board and all the various other state agencies, and now we're publishing them online for you all to see. And that really has started to change some of the conversation that we're beginning to have with even the Liquor Control Board. One of the things that they apparently had not done a environmental impact study. Our researchers were able to uncover that fact, and we started publishing it and talking about it at the public hearings. Now we see that the Liquor Control Board said, oops, well, maybe we better do that. So we're finding that really getting the information out and exposing it to people is really what's making the difference. The other thing is that we're getting people to come out in numbers to meetings, to rallies, to public hearings. And we really need to push this on you guys, that you don't have to be afraid to speak in front of these people anymore.
I agree. I'm a former elected official, and I can't tell you the difference it makes when 30, 40 people, let alone 400 people, show up for an issue. It totally changes the dynamic of the discussion and the vote when elected officials are kept honest about their responses to these things. And it's all too easy to pass bad laws in darkened rooms. So, good work, John. Jared, what's been working at your end?
The internet, mostly. It allows us to reach out, and we're getting organized, and we're sharing our experiences with other people. A lot of people are imitating each other across the country. I've been, with those shirts that I make, I send them all over the country, and it inspires people to, wearing this shirt in public is kind of a big deal over in different states and in different situations. We recently saw in the news that someone who consumed cannabis had their child taken from them, and the person who was taking care of their child allowed the child to die, or through negligence or abuse. I think it's ridiculous. Cannabis consumers are good parents. We tolerate alcohol consumption. Marijuana is safer than alcohol. We should allow parents to consume cannabis. And in Washington, we're pretty spoiled, and even the Northwest or the West Coast, we're kind of spoiled. But other parts of the country, it's pretty bad. So if you can reach out through the internet, you might be able to help motivate people, give them ideas, share some of the things that you do here in the Northwest with other people around the country.
Thank you very much, Jared. Dale, many of us thought California was going to be first out of the gate in terms of legalization over the years because of the progress otherwise. What's going to be different this time around? We saw, I think, the last time that you guys were looking at legalization, there were some internal issues as much as external that changed everything.
There's a lot that's going to be different, and a major difference being this is a different populace of electors we're going to have. These are 6 years. We're 6 years down the line. In 2010, we barely had a plurality of support going into those polls. Now we have growing majorities going forth. This is going to be a presidential year election in California, okay? Off-year 2010 was an absolutely terrible right-wing election. Turnout on our side was atrocious. This is really, unfortunately, it was predictable. You lose an easy 3-4% of your support just by running in an off-year election. And in a place like California that's so expensive to run in, so we're just not going to repeat that mistake again. However, by waiting till 2016, we will inject the marijuana legalization issue into the national presidential race, won't we now? Because they're going to have to debate this question, no doubt about it, if it's going before the California voters in 2016. So we really hope to elevate this whole discussion to a national level, and I think that's going to help us generate some of the support that we'll need in California, the financial support, to get this whole thing through. But I'm really excited about the potential. Our coalition includes, I'm from Normal, and we have it's the California Coalition for Cannabis Policy Reform, CCPR as we call it at the moment, but which is left over from the old Prop 19 campaign that just barely failed, did so well in 2010 and set the stage for what we have here now. It includes the union, the UFCW, the NAACP, of course our old friends in the ACLU, the Drug Policy Alliance, and we have a couple of Latino organizations, and we're really trying to increase our outreach in that community. I'm really encouraged by how broad the coalition is already, and we still have 3 years to go. So I just look forward to seeing what kind of lessons we're going to learn here in Washington with how the feds deal with the situation here, because that's going to dictate our next move.
That's right, WA. You are the canary in the mine shaft, like it or not. It's going to be interesting to see what happens. But you're also clearing the path, right? You're plowing the hard fields we can all walk down. Chris, why don't you tell us what's going on in Boston, what's been working in Massachusetts?
What's been working is, I really think we now have, it's proven that we have the support. We have the numbers, we have the status quo. Before, where everybody was kind of in the closet, we didn't know how many people actually supported this, and we do it public polling questions and paying for, Massachusetts Normal. I think we put a lot of money for going into the 2012 elections for public polling questions to get what type of legislation people would support, what type of wording in the laws, and just and we also got medical that year, so that was a good year for us in Massachusetts. And you know, we have the numbers and we have the support, so we're just rolling with that now. You know, we're just let it be known. You know, it's to have dialogues with people, get out there. We collecting signatures, constantly collecting signatures. Coming up here in 2014, and then in 2015 for the 2016 election, we'll be doing that. And you know, it's really interesting just to see how the mentality has changed. You know, it's okay to have a discussion about this in random places. You know, the supermarket, at work. You know, don't be afraid. You know, talk to your doctor about it. Don't be. And all that's changing, and that's all for the better. And it's making our jobs easier. I know that. So it's exciting to watch. It is exciting to watch to see what's going to happen here in Washington and in Colorado. They are the guinea pigs, you know, so it's exciting times.
Right on. Well, thanks for the good work. If Dr. Sanjay Gupta says it's all right, we can all talk about this right now. Sam, what's going on in Oregon? Tell me about what led to this recent success. How have you guys had such impact?
Yeah, so I mean, so one of the things about Oregon is we're in a unique situation. I mean, we don't really need to do much more education. I mean, there's always going to be education. We still need the mothers, we still need the grandparents vote, right? Because they turn out to vote every single time. Whereas, you know, we're still convincing some of our own, like, it's time to come out and vote for this. If there's one issue you vote for, let it be this one. You know, but the main thing that worked this session in Oregon, which is a little, you know, it's kind of counterculture to the way we normally think about getting things done, which is be really loud, educate, get out there, challenge your politicians, make sure they work for you, and that does work in a lot of states. But I would encourage people to consider the philosophy of less is more. And that is how we passed all of the laws this session in Oregon. We did not do a massive campaign. We did not, run to the top of the building and shout from the skyscrapers saying we need medical marijuana dispensaries. We brought some people in. We created a bill. We hired lobbyists. We lobbied it, and we got it passed, right? And it wasn't a whole big
old school.
It was not a dog and pony show because we didn't need one. I mean, it helped that we had a legalization measure going through the legislature at the same time, so there's all this hoopla over here about what's going on, and then we're the moderates sneaking in over here, right? So I think there's a lot of political strategy that can be had, and really thinking about, you know, changing the mindset of how we pass these laws. You know, if you can't necessarily, it costs a lot of money to put stuff on the ballot, as Dale had already said, you know. It doesn't cost nearly as much in Oregon, but it still costs a decent amount of money, and we're not a state that's known to get a lot of money for our legalization initiatives yet. So, you know, less was more. You know, we got a couple people to testify. We had a patient. We had someone representing every demographic, whether it was a mom, a first responder, you know, people with certain illnesses. We kept it very strict, and we told the community, look, if you want to show up and testify, fine, but let us help you, right? I mean, how many of you want a lobbyist to grow your weed? Nobody wants. I'll tell you, as a lobbyist, you don't want me to grow your weed. I mean, you know, so it's just kind of taking a different approach. And there's a lot of stuff going on there, you know, in terms of how to get it done. But that's what worked for us. We kept it short. We had political connections. We swayed them, and we didn't make a whole bunch of noise about it.
I like it. And I think the one thing that we got to add is that everyone who's here at this table benefits from the work of the people who came before them. None of this happens overnight. This happens over years and decades of work and of information and of convincing politicians and mostly electorate about what needs to be done. I want to hear from you guys. Do you have any question for this amazing panel?
Have you guys even talked to like any unions or anything like that?
Unions? Just a little closer.
Yeah, unions. Like, I'm a union worker, but I'm not working because I like to smoke weed. So it's either I quit or go to work a good job. And like I'm stuck. Like, well, I want to smoke weed, so I guess I have to work at McDonald's. And compared to like making $32, now I'm making like 9 something now. So it's like there's a big struggle there.
Is anybody working on that basically?
I think that's an issue that really is going to have to be dealt with at the federal level, because a lot of the unions and stuff fall under federal contracts, and that's